All right, so coming up, you got a sheet and I don't, so it's, you're cheating. BSI, scene safe, how many patients do I have? I'm going to consider ALS backup. Considering ALS backup means I'm not going to be calling a paramedic to the scene. Considering ALS backup means I'm walking up here. If I find something that could make this a paramedic run as far as an airway problem that I can't handle, I'm not going to hesitate to call an ALS. That's what considering ALS means. Doesn't mean you're going to call them real quick, all right? I'm going to consider ALS backup. How many patients do I have? I'm going to go ahead and have a patient take cervical spinal mobilization, or my partner take cervical spinal mobilization. I'm not going to do it right now so everybody can see. But when we do this and practicing all the way through, I want to see somebody holding that C-spine at all times when you're practicing, all right? I don't want to say, well, Casper's got C-spine. No, I want to see somebody holding it because I want it to seem so odd. If you don't see somebody touching that head, in real life, it's going to trigger you saying, hey, get somebody on the head, because I want you to correlate that somebody's got to hold that head in real life, right? Okay, so you come up, I'm going to check my general impression. What's my general impression of a patient? Again, if they're laying spine, their mechanism, or whatever. I'm going to go ahead and check and see if I have any severe life threats. I'm going to ask what my chief complaint is again, and they're going to tell me the chief complaints. I'm going to come back up at this time. I'm going to check my level of consciousness. Now, when I check level of consciousness, don't stand up here and say, what's my level of consciousness? Because being an asshole that we are, we're going to say, I don't know. Because how can you check a level of consciousness? What do? Hey, are you okay? You with me? So you touch them and find out. That's when we'll tell you. All right? You come back. I'm going to check the airway. Oh, that hurts. All right, and the leg's never kind of gone back from before I broke it. I'm going to go ahead and check the airway. I'm going to see if I have a patent airway, open and patent airway. If I don't, I'm going to use a modified jaw thrust to establish an airway, and I'm going to use a BLS adjunct to keep it open, all right? Or pharyngeal airway. We haven't had that yet. Just assume it's a piece of plastic you stick in the mouth, all right? So I got a BLS airway in. I'm going to go ahead and check my breathing rate, quality, character. All right, they're going to tell me what the rate, quality, character is. If it's in standards, 12 to 20, great. If he's breathing normal volume, I'll go ahead and put him on oxygen with non-rebreather. If he's breathing outside the norm, either irregular, labored, too fast, too slow, I'm going to bag him at this point. All right? Another thing I'm going to do is I'm going to check the chest. I'm going to expose the chest. I'm going to check and see if there's any paradoxical motion, any sucking chest wounds that I need to manage right away. Right? If there's not, we're good. Right? Now I'm going to check for pulse. I'm going to check carotid versus radial, check for rate, quality, rhythm. Once I find that out, then I'm going to be able to see what I need to do from there. I'm going to go ahead and look for bleeding. Bleeding to the head, torso, lower extremities, upper extremities. They're going to tell you. Then I'm going to check for skin color, temp, and condition. And then I'm going to treat for shock. Now, if he's run over by a bus, I probably don't want to elevate his legs in the air because it's going to put pressure on his spine. But I can cover him up. I'm already giving him oxygen. We're already going to make him a load and go, so that's treating for shock at that point. Right? And notice I did make my load and go decision. He is a priority patient based on what I see. Okay, then we're going to start our head to toe examination. I'm going to start at the head. DCAT, BTLS, tick, deformities, contusions, abrasions, punctures, penetrations, burns, tendons, lacerations, swelling, tenderness, instability, and crepits. When I check the head, I'm going to use the broad axis of my hands. Check my gloves, make sure there's no blood. I'm going to go ahead and check the base of the skull, all the way down to the scapulas. I'm going to check for crepitus. I'm going to check for step loss. I'm going to check for blood. I'm also going to check for JVD, tracheal deviation. Right? We're good on both. I'm going to go ahead and apply a cervical collar at this time. Now I'm going to go ahead and expose the rest of my patient at this point. Right? I'm going to go ahead and check the chest, in and down on the ribs, see if there's any crepitus, see if there's any pain, bruising, or whatever. DCAT, BTLS, tick. I'm going to knife the sternum. I'm going to also take breath sounds, mid-clavicular, mid-axillary. I'm gonna go ahead and check the belly. Decap BTLS tick. I'm gonna go ahead and check as far as deformities, contusions, abrasions, all that good stuff. Distension, guarding, and rigidity on the belly. I'm gonna go ahead and check pelvis in and down. See if it's stable. Check genitalia. Decap BTLS tick. Go ahead and check the right leg. Decap BTLS tick. Check for distal pulse. Nope. Decap BTLS tick. Left leg. Decap BTLS tick. PMS all the way up. While I'm over here. Decap BTLS tick. PMS sensation. I'll just go ahead and say that. I would walk around, decap BTLS tick, PMS, dermatomas. My brain's going out. Thank you. All right. Now, if the pelvis is stable, I'm going to go ahead and do a log roll. Well, I don't anybody hold the C-spine, I'll simulate a log roll.
Yeah, I'll roll for you.
No, it's fine. Because I'm going to go ahead and roll him over. I'm going to go ahead and check the spine, check for any type of bleeding, any type of step-offs, might get him over. Then I'm going to log roll him onto tell you what, Virgil, could you grab C-spine for a second? I want to make sure we do this right. I was going to bypass it.
What we do? Roll.
Yeah.
Ready?
Yep.
1, 2, 3.
Oh. Oh,
Go ahead
okay.
and check the spine, make sure it's okay. We're going to go ahead and log rolling down the longboard. In your count.
Ready? 1, 2, 3.
All right. So log roll him over, strapping down chest, pelvis, head, legs. You can let go of C-spine.
Yeah. I was getting out of their way.
Now we're going to go ahead and start our secondary assessment. Before we do that, before we leave the scene, we're going to go ahead and check for our sample history from anybody that can give it to us. After that time, we're going to go ahead and get in the back of the ambulance, start our ride time. We're going to go ahead and have the partner check for airway, breathing, circulation, see if anything's changed. And I'm going to get my first baseline set of vital signs and ask what they are. Blood pressure, pulse, respirations. Once that happens, I'm going to go ahead and start on the hip. Decap BTLS tick. No blood. I'm going to check the eyes for pearl. I'm going to check the zygomas, maxillae, mandible. Go ahead and check the ears for battle signs. Go ahead and check the eyes for raccoon eyes. Drainage on the nose. Check the mouth. Any type of odors or drainage or anything to block battle signs. We're good. Go ahead and check the neck one more time. And again, I can't check for JVD. I can't check for step-offs, but I can check for tracheal deviation. It is midline. Go ahead and start with the shoulders, scapulas, clavicles, sternum. Check the ribs. Auscultate one more time. Mid-clavicular, mid-axillary. Check the belly. Decap BTLS tick. Tenderness, rigidity, guarding. Go ahead and check the pelvis in and down. Check genitalia. Check the leg. Check the patella all the way down. PMS, dermatomes. Check the leg. Decap BTLS. Check the patella. PMS, dermatomes. At this point, we'll go ahead and reassess. Take care of any secondary injuries that I found. Any lacerations or